continuously forms a articular surface with which the dorsal surface or the trochlear surface of the talus gets fitted, right? Like what? This is the tenon, this is the mortise. This is joints with this. This is the tenon part, this is the mortise part, groove. This wood joints like this. This wood joints like this. This is called right angle tenon mortise joint. Alright. So the part that comes from below to fit in the groove, that is the trochlear tali. That is the trochlear tali. And the inner surface of the medial malleolus of tibia, inferior surface, articular surface of the tibia, as well as the inner surface of the fibular malleolus, that is the lateral malleolus. This continuously forms the mortise. This continuously forms the mortise or the groove. And the tenon part that fits into it from below is the dorsal surface of the dorsal articular surface of the talus, right? Now this is the ankle joint. When you describe the ankle joint, you will describe in terms of talus, in terms of tenon and mortise, right? Now the capsule completely encircles this joint, which is thin anteriorly and posteriorly, and it is thick on either side, laterally and medially, right? The capsule encircles the whole of the joint, and it is thin anteriorly and posteriorly, as well as it is thick on either side, that is laterally and medially, and it blends with the medial ligament and the lateral ligament. What is medial ligament? What is lateral ligament? I am going to tell you, right? And the synovial membrane encircles the capsule from inside up to the cartilage of the bone. The synovial membrane never covers the articular cartilage. Synovial membrane never covers the articular cartilage, right? So this is synovial membrane and this is the capsular ligament. Now comes the ligaments of the true ligaments of the joint. Number one is the medial ligament or the deltoid ligament. Deltoid ligament comes as a short note, right? Then the lateral ligament, that is the anterior talofibular ligament, posterior talofibular ligament, and the calcaneofibular ligament. These three are the lateral ligament. Anterior talofibular ligament, posterior talofibular ligament, and the calcaneofibular ligament. Now important is to delineate the position of the ligaments along with the structures around it, right? Okay, as I have drew the deep and adjoining area of the medial malleolus, alright. Then the fibers of the deltoid ligament divides into three strata. Number one, superficial strata. Number two, intermediate strata. And another is the deep strata. Now,
যায়নি আর নাম্বারটি তুললে আবার
দিয়েছে, ওকে, হ্যাঁ ওই নাম্বার ওয়াইজ আপনি তুলে নেবেন। হ্যাঁ, পাশে দেখুন লেখা আছে, এইটাই পরপর করে দুটোতে রাখবেন, A প্লাস B এরকম করে দুটো করে রাখবেন, একটা 2 প্লাস 2 এর হাফ। মেনশন করবেন কোনটা রেডিওলজি কোনটা সারফেস মার্কেট। Tuberosity of navicular. This is the tuberosity of navicular. Tuberosity of navicular. Of navicular. This is the navicular bone. This is the navicular bone. So the fiber that is going to the tuberosity of navicular is the superficial part. The part which is blending with the plantar calcaneofibular ligament. This is the spring ligament, spring or plantar calcaneofibular ligament, calcaneonavicular ligament, sorry. So intermediate part is blending with the medial surface of this plantar calcaneonavicular ligament. Intermediate part টা এইখানে, এইটা হচ্ছে calcaneonavicular ligament, that is the spring ligament. হলো, এই পার্টটা কি? স্প্রিং লিগামেন্ট। এইটা সুপারফিশিয়াল পার্ট, navicular tuberosity। এই পার্টটা থিন পার্ট, that is the intermediate part which is blending with the medial part of the spring ligament, right? Then the rest of the fibers are going towards the medial tubercle of the talus, পেছন দিকে চলে যাচ্ছে towards the medial tubercle of the talus। তোমরা এরকম করে থাকে তো, এইখানে একটা টিউবারকল, এইখানে একটা টিউবারকল, এরকম থাকে তো ট্যালাসটা। এইখানে নেক, এইখানে হেডটা, ঠিক আছে? তাহলে এইখানে মিডিয়াল টিউবারকুল অফ ট্যালাসে এইখানে চলে যাবে, রাইট? তাহলে ডেল্টয়েড লিগামেন্টের তিনটে আর্ম আমরা পেলাম। হ্যাঁ, সিমিলারলি যদি আমাকে এটা দেখতে হয়, ইফ আই নিড টু সি দ্য anterior posterior talofibular ligament, I need to draw it in this direction, ঠিক আছে? This is a self-like projection, which is known as sustainable talus. All right. Now you see the anterior talofibular ligament. This one is anterior talofibular ligament. Talofibular ligament. This one is the posterior talofibular ligament. And this one is the calcaneofibular ligament. So, this is the median ligament. Medial or the deltoid ligament. And this is the three parts of the lateral ligament. Right? Now, let us see the boundary of the ankle joint if we do a transverse section. If we do a transverse section in between the lower end of the tibia fibula and the dorsal surface of the talus, how it will look like? কেরকম দেখতে লাগবে? রেড মার্কারটা দেখো না ওখানে আছে রেড মার্কারটা দেখো ওখানে আছে। শুধু রেড, অনলি দ্যাট। হ্যাঁ, থ্যাংক ইউ। Now draw this diagram. This is a transverse section through the ankle joint. All right. This is the dorsal surface of the talus. This is head of talus. This is neck. This is the body of the talus. And this one is the medial and lateral tubercle on the posterior aspect. Right. Now, this fascia, this is the deep fascia of the, this one is the deep fascia of the leg. This is fascia cruri. And this one is the deep transverse fascia of the leg that makes another compartment. This one is the deep fascia of the leg and this one is the deep transverse fascia of the leg. Now, make leveling. These four tendons are extensor digitorum longus. These four tendons are of extensor digitorum longus. Lekho. Write it down. This one is the tibialis anterior and this one is the extensor hallucis longus. This one is the extensor digitorum longus, 4 tendon. This is extensor hallucis longus. This is tibialis anterior. Put it down. Draw the picture first. So these are the 4 tendons of extensor digitorum longus. Then the extensor hallucis longus, and this one is the tibialis anterior. Right? This is the anterior tibial vessels. This is the anterior tibial artery with vena comitantes. This one is the deep peroneal nerve. This one is the deep peroneal nerve, and these two are the medial and lateral plantar nerve. Medial and lateral plantar artery. These two are the medial and lateral plantar nerve. These two are the medial and lateral plantar artery. Right? This one is the flexor hallucis longus. This one is the tibialis posterior. Write down. তার মানে বুঝতে পারবে না। এখন আমি আছি, জিজ্ঞেস করতে পারবে এটা কি ওটা কি। I will be able to ask me which one is this one, which one is that one. All right. Once I go, you will not be able to understand. So this is the medial malleolus in cross section. The last part. This is the lateral malleolus, that is the fibular part. The last part at the level of the ankle joint. This is flexor hallucis longus. This is tibialis posterior. These two are the plantar vessels and nerve. All right. This one is the peroneus brevis, and back one is the peroneus longus. Peroneus brevis, and this one is the peroneus longus. Now once you draw the picture, don't draw the diagram, and try to imagine which structure is where. It will be easier for you. Once you draw the diagram and imagine this is the section and which structure is where. Done, Didi. All right. This is great saphenous vein on the medial aspect. This is the saphenous nerve. And the posterolateral aspect is the small saphenous vein and the sural nerve. Small saphenous vein and the sural nerve. All right. This is peroneus brevis. This is peroneus longus. Draw it. Now, what is Morty's view? I do not ask common questions from the book. I am fond of asking some questions, the terminology of which you need to know. Right? Like the tenon part, the mortise part, all right. These terminologies must be clear to you. Otherwise, you will not be able to flourish in your study. All right. Now tell me, what is the mortise view? Mortise view is the AP view. Mortise view is the AP view of ankle, where there is no extra load on the ankle joint. Remember the term. There is no extra load on the ankle joint. And the dorsiflexion, this one is the dorsiflexion. It's a dorsiflexion. Okay? So there will be neutral dorsiflexion. So neutral dorsiflexion, no extra load on the joint, and it is the AP view that shows you the continuity of the inner surface of the medial malleolus, inferior surface of shaft of the tibia, and inner surface of the fibula. That gives you mortise, and the dorsal surface of the talus gives you the. So this is the tenon, and this is dorsal surface of the talus is the mortise. All right. বুঝলে কোনটা বোঝা গেল? কখন বলবে এটাকে when you will call it a mortise view, it is an AP view with no extra load on the ankle, and the dorsiflexion is neutral. One day, some of you will definitely guide the radiologist. Radiologistরা যখন X-ray নেবে, you will guide them, and you should be clear about these terminologies. Right? I believe this much will be enough for the ankle joint. All right. Now you need to know the ankle fracture. What is adduction fracture? What is abduction fracture? Firstly, what is the adduction fracture? And what is the abduction fracture? You see, can one show me the inversion and eversion position of the joint? দেখাও আমাকে, show me. কোনটা inversion? হ্যাঁ দেখাও। Footer inversion কোনটা? Inversion means the sole of the foot is looking medially. Sole of the foot is looking medially. As I have told you, it is a modified hinge joint. Why? This moves along a transverse axis, but the transverse axis is slightly inclined downward laterally. এটা নিচের দিকে এই জয়েন্টটা একদম এরো মুভ করে না, ঠিক আছে? This transverse axis is slightly downward laterally. This axis is slightly downward laterally. So whenever if this transverse axis is exaggerated, then the foot will move like this, not this. It will move like this. So this is inversion of foot. Inversion means the sole of the foot is looking medially. Inversion means the sole of foot is looking medially. And eversion means when the sole of the foot is looking outwards or laterally. All right. Now tell me, what is adduction fracture and what is abduction fracture? And what is golf hole fracture? These three things you need to know. Number one, adduction fracture or inversion fracture. Number two, abduction fracture or the eversion fracture. And the golf hole fracture. I will tell you about the movements and fractures, no doubt. To draw the diagram, ask me which one is what. Surface of the talus on the body. There is a comma-shaped articular process, and on the lateral aspect, there is a triangular articular surface. This medial articular, comma-shaped articular surface, that is the upper part of the medial surface, takes part in articulation. On the lateral part, the whole of the triangular surface takes part in the articulation. All right. Now, this is the dorsal surface, this is the dorsal surface of body. This is the neck, and anteriorly that is the head. All right. This head articulates with the which bone? Navicular bone. Right. And posteriorly, there are two projections, that is the lateral and medial, two projections, these two tubercles. Right. Now, this much you must know clearly. তোমরা একটু দেখতে পারো, এখানে থাকবে, ঠিক আছে? ইউ সি দিস features, that is the medial surface has gotten comma shaped surface on the upper part, and the lateral surface of body has a complete triangular articular surface, right? Sustentaculum tali, this one is the sustentaculum tali, a self-like projection on the medial surface, on the medial surface of the calcaneum. This one is the sustentaculum tali. So sustentaculum tali show to tuberosity of naviculum. This one is the spring ligament. From the sustentaculum tali to the tuberosity of naviculum is the spring ligament, right? That is the plantar calcaneo-navicular ligament. So it is the plantar calcaneo-navicular ligament. This is calcaneum from the sustentacular tali to the tuberosity of the navicular. So plantar calcaneo-navicular ligament, right? And the deltoid ligament is the, it has got 3 parts. This is the medial ligament. It has got 3 parts. That is the superficial part, the deep part, and the intermediate part. Superficial part goes to the tuberosity of navicular. The deep part goes to the downwards and backwards towards the medial tubercle. All right. And the intermediate part blends with the plantar calcaneo-navicular ligament or the spring ligament. The intermediate part blends with the spring ligament. All right. So the capsule is, now I can tell the capsule is thick on either side, thin anteriorly and posteriorly, right? যথেষ্ট হয়েছে, তোমরা বলতে পারবে, ঠিক আছে? See this, all right?